Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about some of the circumstances where we might recommend an MRI in addition to a mammogram for you if you're at higher risk. Now, I do have other videos regarding the BRCA risk, the breast and ovarian cancer gene test, but this is a little different. It's related to a scoring assessment that you may get at your mammogram test, and it's called the Trier-Cusack scoring assessment. It's based upon questions like your age, your weight, when you started having your period, how many kids you have, and your family history. And it's based on collecting all of this information and studying the data over time that allows us to project, or the study to project an estimate of your risk. And what's relatively new in the last few years that I've seen change in my practice is that if you have I'll call it a TC score for Trier-Cusack, if you have a TC score above 20%, that puts you in a higher risk category, and that makes you eligible for an MRI. Now, first you get a mammogram, and then afterwards the MRI might be recommended immediately afterwards, or might be recommended 6 months afterwards. This is relatively new change, and it's worth learning about and asking your provider yourself the next time you get a mammogram, and read over your mammogram report and see if there is this TC score, and if it's over 20%, there might be a mention of the option or the recommendation for an MRI. I am seeing more patients who have not been getting the MRI, weren't aware of it, weren't aware of this new trend. The MRI is more expensive, but it is generally covered if you meet this higher risk criteria. Like I said, most insurances are cover it, and it's also a little bit more sensitive to find things earlier if you're at higher risk. But there are also some false readings that are a little bit higher. So it's not instead of a mammogram, but it's in addition to, just like ultrasounds. They each have their unique circumstances, and this is a whole general overview, not to give you specific advice for your circumstance. As always, discuss it with your provider. What I'm trying to do here is bring awareness to patients, recognizing that some meet the criteria and have not been getting MRIs when it's available to them. So I'm also going to provide some links in the narrative for this video so that you can get more information. It is evolving, so be sure that you check for the latest information. This video was made in September 2024. I hope you found this help, and please leave your comments. Thank you.